Press pause now while you read the answers. Press play when you're ready to see the correct answer. Okay, so this question is about someone having major surgery, laparotomy, a cut in her abdomen to operate on the abdominal or pelvic contents. So we are, with this question, trying to make sure that you've been to theatre once and have talked about these big surgeries. Okay, so A, her airway needs intubating, but she doesn't need intraoperative analgesia. Well, we know the second part. We know patients need analgesia, hypnosis, and they may need neuromuscular paralysis. So patients having surgery need analgesia. So option A is wrong, even though it's true she needs intubating. She needs intubating because she's having a big procedure on her abdomen, and she's at risk of regurgitation of gastric contents into her mouth, and therefore from her mouth into her lungs, and we need to put a tube into her trachea, intubate, to stop that happening, to stop the fluid coming back from her mouth into her lungs. So the initial bit of question A is correct, but she does need intraoperative analgesia. Option B, we can use a laryngeal mask airway and an epidural. Well, again, we can use an epidural, an extradural analgesic, something to numb the nerves when they come out of the spinal cord. That's an epidural. But we aren't going to use a laryngeal mask airway. A laryngeal mask airway doesn't go through the vocal cords into the trachea. It just sits above the vocal cords. So that's not true. C, her airway can be managed using a Guedel or oropharyngeal airway. Well, initially it will be managed with a Guedel while we're waiting for the paralysis to start in the first few minutes. But her airway won't be managed with a Guedel during the whole procedure, and it won't be managed because we need to put a tube into her trachea, intubate her. D, she needs to be intubated and will be given an intraoperative non-steroidal, but she will not need a muscle relaxant. Well, to intubate someone, you need to relax their vocal cords, and generally we need to use a muscle relaxant, a neuromuscular paralysis. So option D is sort of contradictory there. So therefore E is true. We should intubate and use intraoperative analgesia. Option E is correct.